Articular cartilage. First of all, is avascular, aneural, lymphatic, and not immunogenic. Nourished by synovial fluid, thickness of 5 to 7 millimeter, had low coefficient of friction, that is 0.0002, 30 times smoother than any modern bearing implant. Anisotropic, viscoelastic, physiological loading and hydrostatic pressure changes are chondroprotective. Functions as a shock absorber, decrease friction, load distribution. Constituency microscopically consists of cells 5%, excellular matrix 95%. Cells are chondrocytes designated towards chondrocytes, which are mesenchymal cell designated towards cartilaginous lineage. Produce excellular matrix, collagen, and proteoglycan. Loss and increased in size with osteoarthritis and aging. Excellular matrix 65 to 80% water, called abundant type 2 collagen, provide tensile strength. Number 2, proteoglycans provides compressive strength. The basic component is aggrecan, which is the largest molecule inside and abundant by weight. Possesses more than 100 types of chondroitin sulfate and keratin sulfate chains. It also consists of elastin. In arthritis, there is subchondral edema, sclerosis, hibernation, and cyst formation. Increase water content due to damage of cartilage matrix and reduce cross-linking. Reduction in prostaglandin concentration and increase degeneration. Hibernation is a pathological change where the subchondral bone is converted to dense, smooth surface that resembles ivory. Regarding the structure, macroscopically it has three structures, that is superficial layer, intermediate layer, and deep layer, then calcified cartilage and tide mark. The superficial layer is thinnest, highest water and collagen content, almost entirely collagen fibers, lies horizontally parallel to the joint surface to resist shear forces. Flat chondrocytes parallel with lamina splendens, covered with lubricin, resist shear. Intermediate zone, collagen fibers are oblique, more round chondrocytes. Then is a deep layer that has longitudinal fibers arranged in columns, round spherical and more concentrated chondrocytes. Then is a calcified zone, anchors the cartilage of the bone, and then the tide mark. There is this acellular boundary between uncalcified and calcified cartilage. It anchors hydroxyapatite crystals to the subchondral bone. Damage superficial to it has poor blood supply. Damage which goes down to the and cross the tide mark will heal. That is the concept of abrasion chondroplasty. Repair is usually by type 1 collagen. Arcade of Benengoff, draw it and explain to him. Regarding proteoglycans, they are hydrophilic molecules responsible for water content of articular cartilage. In arthritis, there is weakness in type 2 collagen meshwork and failure to resist the swelling pressure of the existing proteoglycans. Proteoglycans are basically hyaluronic acid backbones. There is a link protein connected to the via a core protein, and core protein has carnitine and keratin sulfate. This keratin and carnitine sulfate ratio is important in osteoarthritis. Keratin sulfate increases with aging. Increase keratin sulfate ratio in osteoarthritis. These last three is basically aggrecan molecule, that is a link protein and carnitine and keratin sulfate. Proteoglycan gives compressive strength by trapping water. type of cartilage in the body. Physial cartilage is a growth plate. Fibrocartilage and tendon ligaments insert into bones, volar plate. Elastic cartilage is trachea, auricle, and epiglottis. Hyaline cartilage, articular surface, and fibroelastic cartilage, meniscus.